Good morning. This is the OHSU Effect Inside Health and Science at OHSU. I'm Lacey Evans. In just a few weeks, the world will mark World AIDS Day, December 1st. But up at OHSU, they don't take just one day to discuss the virus. Researchers have dedicated their lives to it. With me now on KXL is Dr. Lewis Picker, the Associate Director of the Vaccine and Gene Therapy Institute, who is attempting to develop a vaccine for AIDS. Good morning.
Good morning.
So over the summer, we reached the 30th anniversary of the first AIDS case. How far have we come from then?
Well, quite far, actually, although we still have a ways to go. Back in those days, a diagnosis of AIDS was a death sentence. And in the ensuing years, a whole plethora of antiviral drugs have been developed, such that for people in the developed world, it can basically convert to a chronic disease, and they could live almost normal lifespans. That's a huge advance considering the mortality of this disease in the 80s and 90s.
Your work has been described as the ultimate weapon against AIDS. Tell us about the vaccine that's going on, that's being, born in your laboratory.
Well, as good as the drugs work, they're expensive. They have to be taken for life, and it would be much better to be able to prevent the disease altogether with a vaccine. And so we have dedicated the last 10 to 15 years to this work, and have come up with a new approach that has shown very promising results in non-human primate studies, preclinical studies.
Yeah, tell us a little more about that.
Well, the idea, the AIDS virus is a very difficult virus for the immune response to catch up to. It has the ability to sort of run away by evolving very quickly because it replicates very fast. So that's why it's never controlled by the immune system if you get it naturally, and that's why most vaccines don't work. We found that, and have proven, in fact, that in order to stop the AIDS virus, in this case the monkey version of the AIDS virus, you have to have the equivalent of the immunologic army prepared at all times to intercept the virus when it first gets in the body. You can't have a delay for the forces, so to speak, to build up. It has to be there right from the get-go. And so we've developed a vaccine that does that is able to maintain the equivalent of armed soldiers at the portals of entry of the virus and intercept it very early. And we've shown that if you do that, you can stop it.
How similar is the monkey version as compared to the human version?
Well, actually, very similar. The human version actually came from monkeys. It came from African non-human primates. Monkeys originally, and then went through the chimpanzee before it came to humans. So, what we study is another virus that came from African monkeys, but we study an Asian macaque. So, like humans, they're not naturally infected with it, and they have the same exact disease that the humans get from the AIDS virus, they get from the SIV virus. And so it's a very, very similar disease. It's one of the best animal models out there. And it's very hard for a vaccine to control SIV, just like it's turned out to be for HIV.
Well, this all sounds very promising, but I imagine there is a lot more work that needs to be done.
Yes, I mean we have proof what's called proof of concept, which means that our concept of having what I've called the activated soldiers there at the beginning does work, and in the monkey system, and that's very promising. However, in order to put any vaccine into humans, you have to go through a lot of there's a lot of safety concerns. You have to check off a lot of boxes, and you have to hope that what you do actually translates from the monkey to the human. And that's our primary focus now, and it's going to take a number of years to take our monkey concept and turn it into a real human vaccine that could go forward for regulatory approval, clinical testing, and hopefully, if it works, ultimately approval.
Yeah, that was one of my questions, that how close are we to human trials?
Well, human trials, have different grades. There's the early trial, so-called phase 1, and then that builds up to phase 2 and phase 3. Early trials are just sort of, you test the safety, you get a general readout of whether it's working at all in humans, and that's a very small number of people, let's say a dozen or 2 dozen. In order to show that it works, you have to go into trials that are actually numbered in the thousands of people. Those are a ways off. We're hoping that the initial stage trials are going to be about 2 or 3 years hence.
We have successfully developed so many vaccines. Why is an AIDS vaccine been such a challenge?
Well, AIDS is, and it's taken a couple decades to actually realize this. The AIDS virus is very different from the other viruses that we normally encounter, flu or measles, in that it's evolved to evade completely the immune system. And whereas the other viruses can be controlled by immune responses, in fact, we knew that because once you get measles, you never got it again. So once you get the measles vaccine, you're protected. Anybody who knows anything about the AIDS virus knows that you never get rid of it, and it leads untreated to inexorably to death. So and that's because it evades the immune system. So it's taken this long to figure out whether it has immune vulnerabilities, to define those vulnerabilities, and then to develop a vaccine that could exploit those vulnerabilities. So like I mentioned, the vulnerability we exploit is that when it first gets into the body, before it spreads and systemically and makes this huge, overwhelming mass of viral replication, it's vulnerable, and that's where we've developed our vaccine to hit it.
You kind of mentioned this in the beginning of our interview, but is it more realistic to control the disease with meds as opposed to preventing it?
Well, it's easier, obviously, since we're doing that right now. The molecular virologists and biochemists have made huge strides in again, finding what the vulnerabilities of the viral machinery, so to speak, and developing drugs that specifically target those vulnerabilities and can stop replication. But they can't get rid of the virus. They can just sort of control it. And so if people go off the drugs, the virus will come right back. It is harder to prevent it. We're trying to get nature to do something, and we're trying to get a vaccine to do something that nature has been unable to do. So we're trying to do better than nature. And there's a number of areas now where we're beginning to show some promise, both in the vaccine that we've developed as well as some others. And I think ultimately the vaccine that will ultimately go forward will be one that combines the best features of all of those ideas that are going forward now into one vaccine that will hopefully work most of the time. With AIDS virus, it's going to be hard to get the kind of efficacy we see with, let's say, measles, but we're going to work towards it, and hopefully what we come up with will be able to really take care of the epidemic, especially in developing world where it's wreaking such havoc.
How did you become interested in AIDS research?
Well, I hate to admit it, but I'm 30-year anniversary goes back to when I was in medical school. And I was in medical school in San Francisco, at University of California, San Francisco, and the onset of AIDS was a very big deal. It really hit San Francisco hard, as you might imagine, and both as my clinical training and for the world I lived in was markedly changed by the onset of the AIDS virus into our consciousness and into our society. It's been a major influence on me, both medically and personally. And I didn't initially start working on it, but in the early 1990s, when my research interests began to have some linkage stage where I thought I could do some good, I moved into it and progressively moved to full time. And I came to OHSU in 2000, really just for that reason, to develop an AIDS vaccine.
Where can people get more information on your research, on the vaccine, and maybe for future trials if they're interested in that? Where's the best resource?
I would probably just follow the OHSU website, and usually our advances are kept up to date there. And obviously, there's the scientific literature for those who are interested in reading at that level.
That's great. Well, Dr. Lewis Picker, we really appreciate you being with us on the OHSU Effect. Thank you.
Thank you.
It's Dr. Lewis
Pleasure.
Picker, the Associate Director of the Vaccine and Gene Therapy Institute. And don't forget, we offer the OHSU Effect as podcasts on our website, kxl.com, also at ohsueffect.org. Also, if there is a health topic you'd like us to cover, send me an email at lacey.evans@kxl.com or follow me on Twitter at LaceyEvans. Send me your suggestions. More of the OHSU Effect coming up in 5 minutes on FM News 101 KXL.